Officials at a Dallas hospital are struggling right now to explain the first case of Ebola transmitted in the U.S. That's exactly what that hospital was supposed to prevent when it treated the first Ebola patient diagnosed on U.S. soil. Well, doctors couldn't save him, but now they have to figure out why they failed to contain the deadly virus. Marcy Gonzalez has more from Dallas.
Today, investigators piecing together what went wrong at this Dallas hospital that caused a nurse here to contract Ebola. Hospital officials say she wore a gown, gloves, mask, and a shield while treating the Ebola patient who died here last week. ABC's Dr. Richard Besser explains how a mistake with wearing or decontaminating that protective gear could have exposed her to the virus.
If you have a cut in your skin, it can get in directly, but otherwise if it's on your skin and you touch your eyes, your nose, your mouth, that's how you get infected.
The CDC now saying other healthcare workers who treated Thomas Eric Duncan at Dallas Health Presbyterian Hospital could also be infected.
Unfortunately, it is possible in the coming days that we will see additional cases of Ebola.
Right now, there are 48 people still being monitored who were exposed to Duncan before he was isolated. This nurse was not one of them, only coming into contact after Duncan was hospitalized. Now, experts are looking into her own ring of possible exposure, so far extending just to one person who came into contact with her once she started showing symptoms Friday. Her dog also being monitored. The nurse's apartment now being decontaminated, her neighbors on alert.
Definitely it's scary being in Dallas, but then when it's like right here.
As officials here stress the community is not at risk.
It is not news that should bring about panic.
The CDC now planning to offer more training to healthcare workers here and at hospitals across the country. But some experts stress Ebola patients really need to be treated at one of the 4 hospitals in the country specially prepared to handle these cases. It's something the CDC says is being considered. Marcy Gonzalez, ABC News, Dallas.